the STAR difference is essentially the idea of creating communication between patient, staff, and physician that's unmatched in order to get the patient the care that they want, the things they want addressed. And without communication, you can't accomplish the goals that the patient wants and is coming to see you for. I think secondly, we offer only board-certified plastic surgeons, which gives us the opportunity to work amongst each other and with each other in longer cases, making them shorter and safer for the patient. And I think the mentality of STAR is one of utmost safety and communication. Well, I've been previously to joining STAR, I was in private practice for 6 years with my senior father, Dr. Elan Reisin, in the Washington metropolitan area. My practice encompassed cosmetic and reconstructive surgery equally, as well as hand surgery. I was also involved with teaching residents at Georgetown University Department of Plastic Surgery, who rotated during their 5th years with my father and myself for their cosmetic surgery rotation. I also took biannual trips to the Dominican Republic to help young kids and people with disfigurements in the Dominican Republic for reconstructive purposes in hand and face and breast and body alike. I did some research along the way during my residency at Georgetown for breast reconstruction as well as cosmetic breast surgery, producing some book chapters and some articles with regards to those issues. Prior to that, I was at NIH, which is in Bethesda, Maryland, did research with the genetics department with Dr. Vittorio Gallo, who's world-renowned for having discovered some details involving the initiation of the discovery of the HIV virus. And this was many years ago when I was in my teens. And I was also a patient care technician at Suburban Hospital during my high school years, which started it all off in medicine. After Georgetown, I decided that my dad was getting older and was deciding on retiring, and I wanted to be a part of something a little bit bigger than just myself. I also became engaged to a beautiful lady and moved here with her and got married and started a family here. And that's when I met the people at STAR Plastic Surgery and found that they were a perfect fit for me. The team is incredible at STAR, from the ladies at the front desk all the way to the patient coordination, and the feeling of being at home and part of a team was immediate and gratifying. The patients as well clicked with me and along with the rest of the staff. As far as the importance of being part of a group of surgeons that are all board certified in plastic and reconstructive surgery was first and foremost for me in my decision, as well as the ability to continue in the areas of research in cosmetic surgery and possibly get back involved with my alma mater of my medical school, Wayne State University. Well, I think there's many levels of when should somebody approach plastic surgery. First and foremost is disfigurement. Functional loss are the most important standards that we all live by, and without that we don't feel complete. So reconstruction is the #1 reason. Secondly, after establishing function, you want to establish form. People need to feel good about themselves for everyday reasons, to be effective in life, to be happy with themselves and others, and to have good relationships. I think you need to feel first good about yourself. People should seek plastic surgery when they feel disproportionate in one area of their body in regards to the rest of their body, if they feel as if they don't fit in for a particular reason, which is congruous with reality. I've never been involved in a practice such as this one that gives such a complete and thorough communication process to the patient to allow them to make a very informed decision. As well as, you know, as a physician, you're running from room to room and you see many patients throughout the day, and patients need to communicate what they want from the physician, and the physician likewise communicates to the patient. There are many other aspects of the surgery that are not discussed between patient and physician, and that's where the staff of Star Plastic Surgery comes in. They fill in the gaps. That patient, any patient, does not leave the office without completely answering every question that they possibly could have. And that's what sets this place apart from all the rest, is the patient gets very well informed. They have all the possible procedures discussed with them. The pre-op and the post-op convalescent periods are discussed in detail. And it allows me to be a physician and treat the patient as a patient and have a good communication exchange and decide on the appropriate plan for each and every patient. From top to bottom, you couldn't ask for a better staff. They're kind, they're dependable, they're honest. I find a lot of places that have a setup of plastic surgery, such as this one, are very business-oriented and pushy. We're more family-oriented, and everybody knows each other, everybody's friendly with each other, and everybody has their set roles, and that's what the most important part of this production we have here, is that everybody knows their importance, and everybody is important. Without one, all of us do not work efficiently. We work well together.